So today I want to talk about the difference between using baking soda versus apple cider vinegar for indigestion. There's no doubt that you're going to experience results if you take either or. But the question is, long-term, what can happen? So what I want to first talk about is this idea on pH of the body. There seems to be this push to alkalize the body. And I'm not sure exactly where that came from. It could be, I think there's a book called Alkalize or Die. Could be that, or it could be other things. But people tend to associate health with being alkaline and sickness with being acid. Okay, so I just want to first mention that when you're talking about alkaline or acid, you have to be specific on what part of the body you're talking about, because in the stomach, you need a pH between 1 and 3. This is super acidic. But when we're talking about the blood, we're talking about a very narrow range between 7.35 and 7.45. 7 being neutral, so anything greater than 7 is more alkaline, and anything less than 7 is more acidic. So you can see blood is slightly alkaline. Now, when we're talking about being too acidic or too alkaline, we're really talking about two different conditions. One being too acid would be acidosis, and the other one too alkaline being alkalosis. Now, if you understand the symptoms for each different condition, you can help to use the right remedy. So for the symptoms of acidosis, your nervous system is going to be irritated, you're going to feel nervous, you're going to sigh frequently like that. You might have light or sound sensitivity. You might be dehydrated. You might feel a lump in the throat when you're swallowing. You're going to have a difficult time breathing in high altitudes. And there's certain conditions that can make you more acid, like ketoacidosis, which is a huge confusion for many people. They think being in ketosis is the same as ketoacidosis. Ketoacidosis is a really rare but dangerous condition where you would have to be a diabetic type 1 and not control your blood sugars. In other words, you ignore taking insulin. So your blood sugars go really high, over 300, and your pH starts going high. So that's ketoacidosis. If you're not a diabetic type 1, you don't have to worry about it, okay? It's not going to get that high. But if you have ketoacidosis, you have acidosis, and of course, you would want to alkalize the body. There's another condition called lactic acidosis, and lactic acidosis is another serious condition that can cause even a coma, and this could come from the side effect of taking certain medications. Even metformin has a black label, and it says that it could lead to lactic acidosis. The remedy, the nutrient that prevents this, is vitamin B1 and B12. And then you have alkalosis. Okay, in alkalosis, you're going to have muscle twitching, tetany, which is that little twitching maybe underneath your left eye or the arm or the leg, muscle spasm, cramps in your calf, muscle weakness, dehydration, which is the same over here, because you're not able to transport the minerals properly, allergies, and calcium deposits. So of course, with alkalosis, you wouldn't want to alkalize the body even more. It's too alkaline. Does that make sense? Now, I want to talk about another condition called hypochlorhydria. What that means is that your stomach doesn't have either the quantity of acid or the strength of acid. The pH actually is between like 4, maybe 5, maybe even 6. So you have a higher pH in your stomach. The purpose of this acid is to break down protein, absorb minerals, and kill pathogens. If you don't have the strength of acid in your stomach, you're going to have incomplete digestion of the protein. You're going to have pathogens that could go into the system. And you're also going to have a difficulty absorbing minerals. And one of the big symptoms of that is anemias. And this is a very common problem, by the way, with a lot of people, especially as you get older. So the symptoms of hypochlorhydria are GERD, okay? GERD is basically where the valve on the top of the stomach doesn't close and we get acid coming up here. So it's acid reflux, okay? Next one is indigestion. So think about it. People are taking antacids for GERD, acid reflux, indigestion, which is a symptom of low stomach acid, which is going to neutralize the acid, which is going to then cause the need for more medication, which is going to cause more of the symptoms. Anemia, because you're not able to absorb the iron. Constipation, because you're getting incomplete digestion of your protein. Malabsorption of nutrients. Carcinoma of the stomach, that's cancer of the stomach. And if you have low stomach acid, is that going to cause acidosis or alkalosis? It's going to be over here, right here. So would you want to take something that alkalizes the body or acidifies the body? Well, I think it makes common sense to take apple cider vinegar for this condition and this condition, but take baking soda for this condition. So you might want to try this. If you have indigestion, try apple cider vinegar because in the long run, you can actually correct it. This might temporarily make you feel better, but then the next time you eat, you're back to square one. The other thing you need to know about baking soda is that 1 teaspoon will give you like 1,200 milligrams of sodium. So if you're already high in sodium and low in potassium, your blood pressure might increase, you might have other complications. And also, as far as the sodium and potassium ratios go, the more sodium you take, the less potassium you have, and this can create a whole series of other complications down the road. Most people, by the way, are very heavy on the sodium, but they don't have enough potassium. And our bodies require about twice as much potassium to sodium. So anytime you're going to take baking soda, make sure that you also are consuming a lot of potassium foods or take a potassium supplement so you can keep these ratios in check. And if you haven't seen my video on apple cider vinegar, I have over 10 million views. Check it out on this page.